Good evening, ladies and gentlemen. Welcome to another edition of TBR, and I'm George Binns. This evening we want to talk about Beverly's Department of Public Health. And to help us understand it, we have the new director of the Department of Public Health, Laura
DelleChiaie.
DelleChiaie. I was practicing all the time. It still comes out wrong. Anyway, sorry about that, Laura. Thank you for joining us anyway.
Thank you for having me, George.
So you've been with us several months now?
Yep, it'll be 6 months next week.
6 months, yep. And as we were talking before the show, I did a little research on public health and found out that at the federal government level, we've got about 10 or 12 different agencies. And we saw a lot of the initials go by during the COVID free-for-all. And not to be undone, the state has got 11 agencies with the health in the title someplace. And all of a sudden, Beverly comes down, you just got one. It's all you.
Yeah.
So previously we had a discussion with Rebecca Jackson from the Y, and they get involved in health issues, and we had Ted Lane from the police department talking about some of his issues that they get involved with in health and domestic violence and that kind of stuff. So how does the city's public health department fit into all of this?
Yeah, so let me just give you an overview of how local public health works in Massachusetts. So we're a little different from the rest of the country in that we have 351 different municipalities, all have their own local health government. So at the state, obviously, you have your big agencies as well as the federal level, but when you come to the local level, it's just one department within a municipality, whether it's a town or a city. And a lot of the other parts of the U.S. are by region or county, but Massachusetts is very different in that sense. So we're not covering by Norfolk County or Essex County or Suffolk County. We're covering for Beverly, Peabody, Salem, all individually. But what we do is in public health, we have, it's a very loving community in that we all try to assist each other with the jobs that we're doing. And we do a lot of collaboration through conferences, building partnerships through regional grants, things like that, in order to provide services not only just locally, but regionally as well through resources that we can allocate through our surrounding partners.
Mm-hmm. Well, when you say how do you work with surrounding partners, you don't have an Essex County coordinating you. So how does this function with, say, a Peabody or a Gloucester or something? Or is there any back and forth between us?
Yeah, so it's a lot at the local level. It's about building partnerships and rapport with not only your city departments, but also your adjacent agencies that are working in other different municipalities. So you have to go out and make an effort to work with those other agencies. And a lot of times municipalities or different health departments from different cities and towns will partner when it has to do grants. So for example, we have something known as the Public Health Excellence Grant, which we share with 8 other different communities. And that way we can provide regional services to individuals. So we have a regional public health nurse, we have a regional epidemiologist, a regional inspector to provide more scope of services to individuals when health departments are lacking in staffing, usually due to just a lot of areas we have to cover. We cover anything, from, I'm sure you heard, all the beach testing to food safety to maternal and child health to immunization. So it's a wide array that we cover at the local level. And sometimes we need to partner together in order to allocate our resources better.
Well, in the Beverly office, what kind of problems can you actually address as opposed to ones where you have to partner?
Yeah, so at the local level, what we do on a typical daily basis, I'll just give you an overview of my office. So within my office, we have the director, myself, we have 2 administrative assistants, 1 public health nurse, and 3 sanitarians. And so I'll start with the sanitarians in that they do a wide array of the services that we offer, and that's a lot of inspection and enforcement. So they're the ones going out, testing your beach water quality at 5 in the morning. They're going out to restaurants to make sure food is being prepared safely. They go to your body art facilities to make sure that they're conducting tattooing in a properly sanitized way, and things like that. We also deal with housing cases, like if we have individuals or hoarding and things like that they need help. We deal with rodent control, trash control, anything that can potentially impact the environment. So they're kind of doing primarily inspection work and enforcement work, but as they go out and do that inspection work, they're also educating. So there's always an education piece with public health. We're not a type of agency where we're looking to, bash individuals or businesses or things like that. What we want to do is make sure what they're doing is safe, but also help them along the way to make sure that they continue to get better at what they're doing. And so when you're out at a restaurant, maybe there's issues with hand washing. So the inspector will demonstrate how to properly wash hands, how to, glove and deglove when prepping food. If we're at the beaches, things like that. Are people showering before they go in the water because their sunscreen? Are they bringing their dogs into the water? Things like that that can potentially contaminate these sources that the public uses. And so a lot of it goes on to, enforcement doesn't work unless you have that educational piece, because we're never going to help people get better if we're not telling them what they're doing wrong and how to make it better in the first place. And then items like what our public health nurse does, she basically runs all of our immunization clinics. So when we have the flu season in the fall, we actually have our community-wide flu clinic coming up on October 10th. It's going to be at the Council on Aging from 2:30 to 5:30. So she spearheads all of those and helps also regionally with the other nurses in other departments in other cities' clinics. She also spearheaded giving all the COVID vaccinations when we were going through the pandemic. She also offers services like North Shore Visiting Mothers program. So that's something she does in Beverly, but she also collaborates regionally with her other public health nurses, and that what she does is she gets birth certificates from the town's clerk's office to find out who the newborns are in Beverly. And what we'll do is we'll send out a little card about services we can offer, and the nurse will go out to these Beverly residents of new moms and babies and do a health assessment on the newborn and the mother, provide resources and like a little startup kit. So we try and do a lot of prevention work in the health department. If you think of public health, you think of prevention.
Well, Beverly has had a bunch of articles in the papers recently associated with the preparation for building on Rantoul Street, and the rats came loose. And got to be quite a bit of noise about it. So as you just mentioned, rodent control is one of the issues. More specifically, what does the city actually do as opposed to what do you make happen by having some contract to do something?
Mm-hmm. No, that's a great question. So it is part of it's a community effort when we're dealing with rodents. A lot of individuals are surprised when they say, oh, Beverly has rats. I can't believe that. But it's very common. Every municipality from town to city deal with this type of stuff. But what we can do on the city's end is what we've started this year, starting February. We started a pilot program with our smart boxes. And basically we've contracted with Modern Pests to put out different traps for rodents, which basically electrocutes them and notifies us on how many rats we're catching throughout the city to kind of get a sense on where are our problem sites in Beverly, where are they having more activity. And then when we have those data points, we can investigate why. Is it a restaurant that's not keeping their outdoor grease bin clean or their dumpster clean? Is it excess trash that people are littering in that area? Is it stagnant water runoff? Or is it just neighbors not having well-kept yards, or maybe they're feeding the birds? These are all just everyday living things that we're doing that are going to attract rodents that we might need to just kind of hold back on, because if we don't, the rat population is just going to burst out of control.
Well, what it comes down to is all these small creatures, rats, mice, squirrels, they're the kind of animal that goes around looking for leftovers.
Yes.
And they're just going to be out there searching, and they, in a city, there's a lot of it, and they find it. So it's a real issue. Yeah, squirrels are nice, and they look cute bouncing around the trees, but they're in the same category. And I noticed I got rabbits in my backyard, and I'm living right almost in the center of town. So this is not a barren situation like many people think. They just
Correct.
all around. So it's a continual problem. And you mentioned also the kit for the new mothers kind of thing. What kind of stuff is in the kit?
Yeah, so
kind of
what our nurse will bring to the new mothers is sometimes they'll bring baby blankets. They'll actually also bring this baby box. It's like a cardboard box that they can store all the supplies in, but maybe mothers who don't have the adequate resources, that box can actually also serve as the baby's first crib. They'll also supply like items like diapers, wet wipes for the child, bottles, binkies, what is the other thing? Like little tiny toothbrushes for when the babies start to have their first teeth grow in. All items that a mother is just going to need to have to take care of her first newborn, whether it's their first child within the family, which is more likely because typically we do it for every newborn or that we know about. But so yeah.
Okay, so basically it's a starter kit.
Yes.
So that, and I guess a lot of these newborn mothers have got a few other things on their mind that
Yep.
they don't necessarily get all the goodies. And again, with a city the size of Beverly, it's not terribly big, but it's bigger than the usual, I guess. And it keeps growing. So what kind of a population change are we seeing relative to newborns? Is it a continuing expanding problem, or is it tapering off, or doing what?
That I don't have data on. I could definitely get back to you and look up that data. That would be available through our state's website. Although they don't report citywide data, they'll report it by county. And so we would have to look at our city clerk's office to see all the birth certificates that we've had in Beverly. But overall, based on demographics, our population is mainly white in Beverly, but we are seeing an increased population of Black and Latino individuals. And I'm sure you're aware about the migrant issues that are going on right now. And so we have more individuals from all around the world coming in to Massachusetts, and a lot of them are staying in Salem, Peabody, Danvers, all bordering Beverly. So I think we're going to see more change of demographics in the next decade or so into Beverly.
That raises another interesting question of, you bring in people who are not used to this country. How do you get the word out to them that there is a public health outfit that does some things, coordinates some things, and oh, by the way, when you come in here, you're bringing some things in that we don't have yet. So this whole issue of how do you handle an influx of migrants? That Beverly doesn't have the problem yet, but I'm imagining you getting feedback from, like you say, Lynn and Salem and some of these surrounding towns that are seeing the influx. So how does that change the game?
It's a overall large public health issue for the state that at the state level, Department of Public Health, we're still trying to navigate, but through the local level, what we're trying to do is be boots on the ground, direct outreach to this individual.
Yeah.
So if we know that there's a hotel in Salem that a bunch of migrants just came in, maybe they're from somewhere in South America,
Yeah.
they have certain endemic diseases that we don't hear. So maybe our nurses go over and they provide vaccinations. Maybe they're telling them about what the local health department does. So a lot of it is having to communicate with individuals or groups of people at the local level in person to kind of let them know what services are available to them. Unfortunately, a lot of social services are they're understaffed right now, underpaid, and so there's not a lot of them right now, and that's a big issue that we don't have enough access to social services to deal with not only our current residents, but also new individuals that are
Yeah.
coming into our communities.
Well, you mentioned going over to Salem. Does somebody from Beverly actually go to Salem and work there? Is it a support effort that you're providing?
We can potentially, if requested by Salem Health Department. Like I said, this is when we work regionally or collaboratively through the region, and we're close partners with our surrounding communities, and say their director or public health nurse asks, all hands on deck, can you all
Yeah.
come and vaccinate some individuals? We would do that because
Okay.
it's overall public health effort. These individuals could also be coming into Beverly eventually.
Oh, yeah. Sooner, well, not what the prices are on here, but that's another one of my battles, affordable housing. But I like the one that Andrew DeFrenza uses, housing that is affordable. So that's another long story, but it goes on forever. But, okay, so we're talking about supporting the surrounding towns. So I guess you just mentioned early on there's going to be a vaccination clinic at the senior center. Is that limited to Beverly, or is that anybody that shows up?
Typically, what we do is vaccinate Beverly residents, but we're not going to turn individuals away because the whole point of immunization is to get the general
get the herd
public
immunity, yeah.
Exactly, and to get the public vaccinated. So I would never turn away someone because they were from Rockport or something like that.
Yeah.
It's just not how we work in public health, but primarily it will be Beverly residents. We're very fortunate in Beverly to have a lot of medical resources, like the Cumming Center. We have a lot of doctors, pediatricians around here. We're fortunate to have our own hospital. So our demand for vaccinations is not as high as maybe, say, a rural community, maybe like Topsfield or something like that, where they don't have all those resources. But it's still something that we need to provide for individuals, and it's obviously free of charge.
Well, they also have clinics, I guess, at some of the drugstores around town.
Yep.
So there's a lot of available resources. And again, it gets down to the issue of how does somebody find out about these things? And as I go into CVS on occasion, they will have to sign up that we're doing this kind of vaccination, and it's usually covered by some sort of medical insurance.
Yep.
So it gets to the next issue of, okay, if you don't have medical insurance, how do you get vaccinated?
So with the health department, what we do is we vaccinate whether or not you have insurance. If you don't have insurance, the health department has to eat that cost of giving the vaccination. So obviously, we try and get individuals vaccinated. But what we can do also is get reimbursed through state vaccine if we do have that vaccine. It's the same as the private vaccine, only state vaccine is primarily for children and sometimes uninsured individuals when need be. And we use that vaccine because the state will reimburse us an administration fee portion of that. But if we don't have that state vaccine, we will use our private vaccine in order to vaccinate individuals. We typically don't have that issue. I mean, it might be a newer issue now that we have individuals or migrants coming into our communities, but in Massachusetts, it is a law to have health insurance, and so some form of health insurance will be covering those basic vaccines.
Well, I start to think about the homeless population, and you see them around town.
Yep.
They're here, and it's a real situation.
Yes.
And as you talk about the situation about vaccination, one of the reasons to get everybody vaccinated so nobody's carrying it and spreading it around. And you get to the situation of how do the homeless get vaccinated?
Yep.
Can they show up at like the senior center or
Of course.
where else would they go?
They so any public health department, obviously we're a public service,
Yeah.
and what we do is we provide free vaccination. So if individuals of the homeless population wanted to come in and get a vaccine, they could do that, and obviously it's of
Come
no
in where?
cost to the health department,
'Cause-
or where we're ever having our flu clinic. So in this
Yeah.
case, it's in the same building as the health department. We're currently housed in the same building
Yeah, you're in
as the Council on
senior
Aging.
center, yeah.
Yes, and so they would just be able to come in on the day we're having our immunization clinics, and say they're not able to come in on the day we offer the clinic, we could refer them to the other clinics that other cities and towns are having that they
Yeah.
could go to. But that's one way. I'm not sure how it works with CVS and Walgreens because they're obviously private
Oh, yeah, they're
industries.
private. They're in for making a profit out of it. Yeah,
But obviously,
Yeah.
what our goal is to do is to protect
yeah.
the overall population.
So I guess you get to some of these issues that, yeah, there's a service available. How do you get the word out that it's available to everybody that needs it? And I tend to think that a lot of people that really need it don't have the access to the information, or they find out about, oh, it was last week, or something like that, and how do you get them restarted? So I guess what you're telling me is that if somebody's got a question or a problem, they should show up at the senior center, and on the first floor, you got an office,
Yep.
and there's a bunch of people in there that would either give them the shot or tell them where to go to get it.
Yeah, what we do is we direct a lot of resources to individuals. So if we don't necessarily provide it in our office, we try and find a resource that can provide it for them. And so we try and bridge that gap with access to resources.
Yeah. And by the way, ladies and gentlemen, you notice every so often her phone number and email shows up. So if you've got a question or a concern, that's one of the resources. It's right there. Anyway, so we got a lot of issues related to health. What's coming up again is maybe we're going back to masks. Maybe we're going back to another series of shots for COVID. What are you hearing about this? What's your thinking?
Yeah, so I don't think that we'll be going back to mask mandates now that the public health emergency is over. So as of May 11th of this year, the state and the governor declared that the pandemic emergency is now officially over. And so that stopped a lot of mandated requirements, especially for individuals in the healthcare system. Like you will see your doctors might not wear a mask all the time and only when they prefer it, things like that. But it's also stopped certain resources coming in. So we're getting a lot of free resources like COVID test kits, masks, face shields from the state that we're not necessarily going to get anymore because of the state of emergency is over. Currently, we're not going to be providing COVID vaccine in the health department. That could change in the future.
Yeah.
It all depends kind of how the state wants us to direct that, whether they'll reimburse us for the vaccine or if we have to get it privately. And also, is there a demand for it at the local level, especially in Beverly, seeing as we have so many resources that provide the COVID vaccine. So does the health department also need to provide it? We're not seeing that right now, but that could change. And obviously, as we get into the fall, we're going to see an uptick of illness as people go into indoors and closer confined spaces. We're just going to see, infectious disease like flu and COVID peak.
Yeah. Well, the flu season comes every year.
Yep.
It's built into the calendar. And at the same time, I keep hearing or seeing in the news at the national level, they're talking about another series of shots, a new vaccine. So what I'm kind of curious about is how does this dribble down to us?
So we, in the local health department, we get a lot of our direction from the state health department through the Office of Local Regional Health. They'll typically keep an eye on what's going on the national level and specifically how our state needs to respond and what we need to do at the local level. So I know during the pandemic, you saw, everyone was going to get their COVID vaccine free of charge. It was going to be 2 boosters. And then what the state does is communicate how that's going to operate at the state level down to the local level. So that's how we kind of get our information and how we're going to navigate our healthcare resources at the local level.
So we're getting down to the point, I guess, of we may or may not get direction from the federal government to the state, and the state will in turn tell us, you, what to do next. And maybe they'll provide resources, maybe not. And that gets to one interesting question is, I've got a whole bunch of COVID tests left over from last time around. How long do those things last?
So they do have an expiration date on them. There's a little QR code on the back that you're able to scan. It will give you a lot number, and it will tell you based on, I believe, data from DPH and the CDC website when those lots expire. So, for example, in the city, we still have some COVID test kits, and they're not going to be expiring till November. So I would encourage you to look at the QR code, see what the date is when it pulls up, and that will give you when they expire.
Yeah, because I got those things stacked all over the house and masks to go with them. I don't know if we're going to play that game again this year. But anyway, believe it or not, we've had our half hour of fun.
Wow, so quick.
And like I said, it goes quick. And I want to thank you very much for joining us. And if you've got any comments you'd like to make, you can invite the clientele to show up at your office or...
Yes. I just want to say to anyone who needs help accessing resources or referrals or something like that, please contact the health department at our main number, which is posted on the banner below. You're also welcome to contact me directly through my email at DelleChiaie@beverlyma.gov. If you need any assistance in the health department, even if we can't provide the service directly, we'll try and figure out how we can get you there.
Well, thank you very much for joining us this evening, and welcome to Beverly, and hope you enjoy the job.
Thank you, George. I appreciate it.
And ladies and gentlemen, thank you for joining us. And you'll notice at the end of the credits is my email address. If you've got some comments or you want some room here at the table, let me know. And again, thanks for joining us, and we'll see you next time.